Hi, I'm Jennifer Stelfox, Doctor of Veterinary Medicine and Certified Canine Rehabilitation Therapist. Today we will be discussing advanced therapeutic exercises. These exercises are considered to be advanced because they take a little more effort on the pet's behalf. Physical training goes a long ways to build up strong muscles and tendons, which will strengthen and support joints. I encourage you to consult with your veterinarian before doing any of these exercises to make sure that they are appropriate for your pet. Remember, cold muscles and tendons do not move very well, so it is important to take your pet out for a 3 to 4 minute walk, massage the muscles, or to apply heat. Balls can be incorporated into an exercise program for dogs. They help stimulate muscle contraction through the rhythmic movement of the ball. Large dogs can have their forearms placed flat on top of a ball. In this case, I'm using a peanut ball for Amy. Their weight is now supported by their back legs. A cookie is then offered in an imaginary box around their head. By offering the cookie to the left and the right, front and back, up and down, areas around their head forces them to shift their weight and readjust. This strengthens the neck, hind leg and trunk muscles and also enhances balance. Look at the nice contraction of the back leg muscles as Amy rolls forward slightly to reach that cookie. These exercises also lead to improved elbow and shoulder flexibility. Small dogs can be placed in a standing position on top of the ball. You must always maintain physical contact with them to prevent falls. It may not be obvious, but Ruben is working very hard by contracting his core muscles and his leg muscles to maintain his balance on the ball. Rocker boards can be used instead of balls and are a bit more challenging. Place all 4 legs on the rocker board and you control the amount of movement that the rocker board makes. You can shift the board so that the dog will first balance from side to side and then from front to back. This can work all muscles of the body and is great for the core. You can make the front legs work even harder by placing them on the ground with the hind legs remaining up on the board. This can also be repeated with the front legs on the board and the hind legs on the floor. This exercise requires the use of a tension band or a tensor bandage. The objective is to work the muscles of the inner and the outer thigh. First, we place the band around the inside of the dog's upper thigh. It is important to make sure that the dog's leg is straight and to place the band as high as possible up on the leg. The idea is to have the band create enough resistance to make the inner thigh muscles contract against the band, thus maintaining the leg in its original position without physically moving the dog's leg. A slight pull should be more than enough to feel the dog's inner thigh muscles working against the band. Developing strong inner thigh muscles, also called adductor muscles, are important, as these muscles will keep the dog from falling over when walking on uneven surfaces. The band can also be placed on the outside of the dog's upper leg and we can pull towards the center of the dog's body. This resistance makes the outer thigh muscles, also called the abductor muscles, contract. Sideways walking is a great exercise for pets with osteoarthritis as it strengthens hip and shoulder stabilizer muscles. Stand beside the dog with one hand on her hip and the other hand on her collar. Gently guide her to move towards you and take 5 to 7 small steps. You can wrap a leash under her belly so she doesn't sit down, or you don't have to bend over. Repeat then on the opposite side. Backwards walking makes a pet shift their weight to the rear, which strengthens the hamstring muscles. Many older pets suffer from hind end weakness and have difficulty getting up. Backwards walking helps this problem. Place a cookie to their chest and give the command back, and have them take 4 to 5 steps backwards. If they try to sit down, you can place your hand or a leash under their belly. Exercise equipment called cavalettis consists of a series of obstacles that a pet must step through. Cavaletti exercises enhance proprioception and balance and also strengthen trunk and leg muscles. At home, if you don't have cavaletti poles, don't worry. You can use broom handles placed on rolled up towels or even use a ladder placed face down that your pet must walk through, providing your pet is tall enough to navigate the rungs of the ladder. The size of your pet is an important consideration when setting up these obstacles. The space between the poles should be proportionate to the dog's size to allow free and easy movement. For a beginner dog, start with the poles about 1 full body length apart and have about 4 to 6 poles per pass. As for the height of the rails, it depends on the dog's height and capability. It is very important to keep your pet motivated through these exercises. Praise and small amounts of a low-calorie treat go a long ways to keep your pet excited as they go through the rehabilitation program. I encourage you to work closely with your veterinary team to help your pet become the best it can be. Thanks for watching.